Hey everybody, this is Patrick McGrath. I'm the Clinical Director of the Foglia Family Foundation Residential Treatment Center at AMITA Health, and with me is Ben Harris.
I am the owner and director of the OCD and Anxiety Center in Oak Brook, Illinois, where we have myself and a team of 8 therapists total who treat OCD and anxiety-related disorders.
Wonderful. So lots of people have sent in questions about OCD, who treats OCD, what is it, what's the best treatment, all those kinds of things. So thought today we'd gather up some of those questions and you and I can kind of bounce back and forth and talk about them, answer them, and give kind of our different perspectives that we might have about it, and especially with different levels of degrees and things like that we can kind of go into too, and even talking about different ways of treating it. You've got more of the one-on-one sessions to intensive, and I've got intensive to residential, so we can kind of touch base on those too. All right. The first question that came in is different types of people who treat OCD. So we can start with a psychiatrist, somebody who has a medical degree, who has gone to medical school and whose job it is really to work on prescribing medications that treat OCD. They may do some therapy as well too, but the vast majority that I know mostly do medications. Now there's people like Mike Janicki who do lots of cognitive behavioral therapy and exposure therapy work, but I'd say the majority are more on the medication side.
That's my experience as well.
Okay. Or now they're doing a lot of research in the neuro side as well too, to see neurological correlates of OCD and things like that. Okay. And they, of course, are potential good referral sources. So if any of you out there are clinicians and you're looking to kind of get some more referrals for OCD patients, get to know a couple of psychiatrists in your area, because they will want to refer to you.
Yes,
I'm sure
absolutely.
You get that all the time.
And we are wanting to refer to them too, because it can be very difficult to find a really great psychiatrist. And when you do find a really great psychiatrist, you can get 6 to 18 month wait lists, so that can be kind of frustrating for patients as well. But it's definitely nice to be able to establish that working relationship with a psychiatrist who you can trust.
And they really want a good therapist to help their OCD patients, because they often report how difficult it is for them to treat it alone. And even the American Psychiatric Association recommends that the best form of treatment for OCD is exposure therapy or exposure therapy plus medication, that it would never be meds alone. So good things to know. Then there's psychologists, could be a PhD or a PsyD that you go to graduate school for. So you get your undergraduate, then you get your master's, and then you can go on for a doctorate degree. So clinical psychologists are also called doctors as well too, but you can also get a doctorate in social work, you can get a doctorate in counseling, so you can get an EDD, an education doctorate, but still do therapy as well. So there's lots of different types of doctors that can treat OCD that don't go the medical school route, but go the graduate school route. And then there's people who go for a master's degree. You've done that?
I do have a master's degree, so I got my master's from Northern Illinois University, and what that
Go Huskies?
Yes, go Huskies. What that allows me to do is I got licensed as a licensed clinical professional counselor, or an LCPC. So there are different levels of master's level therapists as well. So we've got the LCPCs, we've got licensed clinical social workers, we have licensed marriage and family therapists. John Hirschfield is one of those, right? Yeah.
Our buddy John is,
lots of folks, as us lowly master people, we can get really well trained, and we can do really great work. And I dropped out of grad school because I didn't want to do the PhD thing.
It happens. Yeah.
Too many extra letters.
And also, some of those letters, like you were saying, LCPC or LPC, may change by state as well too. Right. So just know that that's the case. There's also social workers, so MSW, LSW, LCSW, that can do it. Counselors can get a master's degree and get licensed. So lots of different, you might see it from different fields like clinical psychology, counseling, social work, marriage and family, as you said as well too. So various ways of getting to here. Right? I think it covers most of them. Yeah. All right. And then we have psychiatric nurses and nurse practitioners who can also prescribe medication. They've gone to nursing school, but they go on for some advanced training and to be able to specifically prescribe medications. And some of them might even decide to specialize in treating people with OCD, or work in an OCD clinic and work in conjunction with a psychiatrist to prescribe. A lot of psychiatrists like to work with nurse practitioners because it helps them to be able to see more people, and they can supervise the nurse practitioner who is doing the medications, and that way broaden their practice as well. And we work with some that are great. We love our nurse practitioners at our work.
I just met one few weeks ago that was referring a child or teenage patient who she had worked with and done some CBIT training. So these are cognitive behavioral interventions for tics and Tourette's. So Mindy Meyer is her name. She does fantastic work. I've really enjoyed my conversations with her. So what she did is she got the tics really well under control for this kiddo, and then when it got more into my line of expertise with the OCD and things like that, she referred to me. So I won't hesitate to refer if I'm feeling kind of out of my league with any of the tic related stuff, and we have started a good relationship with that.
Yeah.